Did you know that while sleeping you could be silently damaging your heart? I am Dr. Jose Ramirez, a pulmonary critical care and sleep physician, and today I will reveal the shocking connection between obstructive sleep apnea and heart disease. I want you to look at real data from a couple of sleep studies, one that is normal and that what explains severe sleep apnea. I want you to see the changes in heart activity and oxygenation throughout the night. I want you to understand and learn when to suspect the sleep apnea and what to do about it. So Mr. D was referred by his cardiologist to our practice because he was having difficulties controlling his high blood pressure. He had hypertension, elevated blood pressure despite being on 3 medications for blood pressure control. His wife had been nagging him for a few years about his snoring that was quite disruptive, but of course this was not an issue for him. He admitted that during long commutes he was feeling a bit sleepy. This is the data that we obtained. I want you to focus on the first two graphs. The one in black displays oxygenation. The one in red displays heart activity. During the night, our oxygen is supposed to be steady. In this abnormal sleep study, you see that the patient spent close to 3 hours with an oxygenation below 90%. You also see how the heart is jumping all over the place. There's frequent ups and downs, which is extremely abnormal because when you're sleeping, your heart is supposed to be resting. On the contrary, the normal sleep study displays a steady state oxygenation, no oscillations, and the heart is also on a very relaxed state. So very little heart rate variability versus frequent ups and downs. The combination creates a perfect storm for cardiovascular disease. It is like revving up your heart at a time that is supposed to be resting. It's going to keep your heart in overload mode when it's supposed to be at peace. So what is sleep apnea? Apnea is cessation of airflow into your lungs and stems from an obstruction. So the back of the throat is a collapsible area, it's a floppy area. When we're awake, muscles keep taut and the airway is open. When you go to sleep, those muscles relax and the space narrows. But it should not narrow to the point of collapsing, and that is what happens with sleep apnea. The back of the throat literally collapses for a few seconds during sleep. And the way you react to that collapse is by a micro-awakening, a micro-arousal to open the airway again. And the price that you pay is sleep fragmentation, sleep deprivation. The amount of deep sleep goes down. You lose sleep quality. So why will you have a sleep apnea? Why does it happen? So there are anatomical factors, that means how you're built, how you were designed, the size and length of your tongue, the size and length of your jaw, the width of your jaw, and your palate, the soft palate. So if you're built in a way that the space is narrow to begin with, because of the way you're designed, then that area is prone to collapse. If you're overweight or heavy set, then the problem escalates, or the problem might stem just from overweight, because fat accumulates around the muscles in this area, and it even accumulates on the tongue and makes the tongue heavier. But it is very important to understand that this is not a problem only of overweight patients. I have had over the years many patients with optimal BMIs, body mass index, and still moderate and severe sleep apnea. Even children can have sleep apnea. So when should you suspect sleep apnea? 90% of the patients with apnea snore. And that does not respect females, They have a hard time accepting that they snore, but they do snore too. But keep in mind, 10% of patients with apnea might not have snore, or at least not loud, disruptive snore. Many patients with sleep apnea just wake up feeling not rested or not fresh, so sleep is unrestorative. And because of such, there's daytime sleepiness or daytime fatigue. Many patients with apnea wake up to urinate at night. We call that nocturia. It is not normal to wake up to pee at night. And I know, they come and they say, hey doc, I stay hydrated, I drink a lot of water, and that's the reason why I wake up to pee. Well, guess what? There are hormonal changes designed to protect you from waking up to urinate. So if you're waking up to urinate and you snore, that's a big red flag. Sleep apnea might cause morning headaches or in general increase the frequency of headaches throughout the day. Sleep apnea affects focus, memory, reaction time, and productivity. So throughout the day, you're less productive, you're more tired. And then if you are sleepy when driving, that is a danger. That of course increases your risk of accidents. Sleep apnea, sleep deprivation, sleepy driving has been compared to driving under the influence. Some patients might wake up with palpitations. Some patients might wake up themselves from the snoring. Sometimes the bed partner might say, hey, this is not just snoring. You're choking during sleep. But many patients will say, I am perfectly fine. There's nothing wrong with me. I feel good, doc. I don't see why I was referred to this practice. I don't have any problem. Just some snoring disrupting my wife. Now I want to dive into common cardiac conditions associated with sleep apnea. The first one is high blood pressure. There's a strong association between hypertension and sleep apnea. In particular, difficult to treat hypertension. Hypertension that is difficult to control should raise red flags about the possibility of sleep apnea. Some studies support that 70% of patients with difficult to treat hypertension have sleep apnea. Another important condition is something called left ventricular hypertrophy. In basic language, that is abnormal thickening, abnormal bulking of your heart. That contrary to bulking of legs, arms, and chest, it is a situation that affects how the feeling of the heart, so how blood fills your heart, how blood is distributed backwards when you have that situation, and that leads to problems. Some patients might have something called diastolic dysfunction, which is associated with something called heart failure with preserved ejection fraction. That means the heart function, the pump, the percentage of blood that goes out of the heart is normal, but the heart is stiff, and that can lead to heart failure. It's one of the most common causes of recurrent admissions to the hospital because of heart failure, and it's difficult to treat. Sleep apnea contributes to blocking of your coronary arteries. We call that coronary artery disease, and that can lead to myocardial infarctions. Sleep apnea is associated with abnormal heart rhythms, too slow or too fast. And sleep apnea is associated with increased risk of something called sudden cardiac death, which is dying during sleep because of an abnormal arrhythmia. Many sudden cardiac deaths will occur between 1 a.m. and 5 a.m. in the middle of the night. If you are prone to this type of arrhythmias, sleep apnea is gasoline for those abnormal heart rhythms, both ventricular tachycardia and ventricular fibrillation. Another very common abnormal heart rhythm is called atrial fibrillation. It is one of the most common causes of hospital admissions because of too rapid of a heartbeat that causes many issues, including stagnation. So the atrial fibrillation causes a stagnation of blood into your heart. There's an area on the left side called the auricular appendix. And if there's blood stagnation there, then you can form clots, and clots will lead to vessel occlusion, most common in the brain, and that can lead to a stroke. There is, in general, besides this atrial fibrillation, a strong association between sleep apnea and stroke. In particularly ischemic stroke, meaning a blood vessel blocks and there's no airflow and you develop a brain infarct. If you look into data, large studies, data from the American Heart Association and the European Journal of Cardiology, overall, sleep apnea is a risk factor for something that we call MACE, major adverse cardiovascular events, that encompasses myocardial infarction, non-fatal stroke, sudden cardiac death from arrhythmias, and the need for urgent coronary revascularization, meaning an intervention to open the blood vessels of your heart to save your life, either putting a stent or doing a cardiac bypass. Sleep apnea is considered a risk factor for recurrent MACE, major adverse cardiovascular events. I hope you find this information valuable. If you suspect that you might have a sleep apnea, talk to your doctor about it. It is extremely easy to be tested for a sleep apnea because current technology, and in particular if you use an accurate home testing device, you don't need to go to a sleep center to have an uncomfortable night. If you know somebody that might be suffering from this problem, share this video. Share this video with a loved one. Thank you very much for taking the time to watch this video, and welcome to my channel. Like and subscribe.